The Innovation Challenge is a grassroots platform that engages and activates 18,000 caregivers around innovation. Every caregiver has an opportunity to vote. The 26 Innovation Challenge projects have had wide variability in terms of their focus. We've had projects that have looked at pricing transparency. So we've looked at models where we've used lay leaders within our Latino and Hispanic communities that have provided basic health education. And we've had projects that have really helped new parents with their infants in the NICU with bonding. Innovation is really the realization of the human drive to make the world a better place.
We developed the core values because we believe that our employees live them out every day. We ask people to hold them up to one another and to reflect those core values in the work that we do every day.
It is a just thing that people receive adequate health care and have access to adequate health care.
We pride ourselves in the excellent cardiac care that we give in this hospital, and I think that's part of the
stewardship. It's one of the things we do a lot because we are always trying to make the best possible situation given the amount of healthcare money.
Treated with respect and human dignity. It doesn't matter whether there is compassion for the human soul.
I think that all of our providers here are very compassionate about what they do.
We do ask people who do join the organization to respect the core values, to respect the people that they work with, to respect the people that they care for. We ask them to support the mission and what we're all about.
Providence Health System can.
We strive to meet the health needs of people as they journey through life.
The experience of having my son was overdue, and so we scheduled an induction. We came into the hospital and got hooked up to all of the monitors and the equipment that are required when you're induced. After a number of hours beeping and lights were flashing, and they rushed me down the hall for an emergency C-section. And I think that this is probably one of the most powerful experiences I've had as a healthcare consumer, but also being in my own facility, to see this vast resource of people that I know personally and professionally. Inspiring experience, and I'm hopeful.
Visitors, family members come into some of our settings. Hi, I'm Sister Kay Belcher.
We're the busiest emergency department in the state of Washington. We currently have 2 small physical plants. We'll be
it's about as low as you could go, according to that survey.
At data suddenly that we never had access before.
We also used a lot of operational excellence tools that Providence has invested a lot of time and expertise in. We learned really pretty quickly not to be shy to ask for help.
One area that jumped out at us is
education to all of us as to what patients perceive and what they're unsatisfied about. And some of those fixes have been really easy fixes. It's a lack of communication, or they just want to know your name. Simple things. I think that as we move into the new ER, we'll have challenges there, and we'll have to remind ourselves to go back to just some
help us. The tower will bring new challenges to us. The tower was designed by the staff.
So we're going to mine other data and look at other processes, and we'll continue to make more improvements.
What we were finding was that our volumes of emergency patients were increasing pretty steadily.
Our volume is up around 200, whereas just a few years ago, average was 160 patients in a 24-hour period.
We really look and try to respond to
brainstorming. What are some things that we can do? Who else has done some great things to address these problems? And our emergency department staff came.
Potentially see them, treat them, and then disposition them back home directly.
To greet them at the lobby and start their care there. So we get tests ordered early. We order lab work, CT scans, ultrasounds from the lawn. Start again. We did have to add extra staff to triage.
The benefits of patient satisfaction and reduced length of stay, those are huge. Those are things you can measure today, and you can actually put a price on them.
My big fear was that we were going to get there.
The SCIP measure has been developed in order to reduce the risks of postoperative surgical site infection in surgical.
Our goal is to make sure that every patient has a best outcome possible from surgery.
In the Providence strategic plan for safety really tells us that we shouldn't accept any infection as an outcome of the care people receive in the hospital.
If we can standardize the process of delivery of antibiotics, then we can hopefully optimize their outcome.
One of the things that we could call the SCIP committee.
The purpose of this was to bring everybody together to see what we were doing and give feedback on a monthly basis to all members of the team so that we could make improvements.
It's extremely difficult to get everybody to standardize their practice so we could be delivering the antibiotics 100% of the time. We standardized one antibiotic that covered 80+% of all surgeries done in an operating room with one single dose of that antibiotic.
So everybody was working on one standard order set.
We made life easier for the team to do their work, and we're able to improve our compliance with delivering the right antibiotic on time at the same time.
So the majority of the patients have everything standardized, ready to go when they come through the door.